First responders, a lifeline for the intoxicated. In the chaotic moments when someone is found intoxicated, first responders are often the first line of defense. Their quick thinking and immediate actions can make all the difference. Written by Dr. Sanjay Gupta, CNN. Dr. Gupta, a renowned medical professional, brings his expertise to shed light on the critical role of first responders in these high-stakes situations. Intoxication, whether from alcohol or other substances, is a common medical encounter. It can happen anywhere, from a college party to a quiet evening at home, and the consequences can be severe. First responders play a crucial role in providing immediate care and ensuring the safety of intoxicated individuals. Their training equips them to handle these situations with precision and care. Prompt action can be the difference between life and death. Every second counts when dealing with intoxication, as the patient's condition can deteriorate rapidly. This essay will guide first responders on how to effectively manage intoxicated patients using a clear, step-by-step approach. Understanding the protocols and procedures is essential for providing the best care possible. Recognizing the signs of intoxication is the first step. This involves being aware of the various symptoms that can indicate a person is under the influence. These signs can vary depending on the substance involved, but often include confusion, slurred speech, and lack of coordination. Each substance affects the body differently, and recognizing these differences is crucial. Changes in behavior, such as agitation or aggression, are also common. These behavioral changes can pose additional challenges for first responders, requiring them to be both vigilant and adaptable. Once intoxication is suspected, it's vital to assess the patient's airway, breathing, and circulation, often referred to as the ABCs of first aid. Remember, every second counts. Ensuring these vital functions are maintained is the cornerstone of emergency care. By following these guidelines, first responders can provide essential care and potentially save lives. Their role is not just about immediate intervention, but also about stabilizing the patient for further medical treatment. Let's delve deeper into each step of managing an intoxicated patient. From the initial assessment to the final handover to medical professionals, each phase is critical. When first responders arrive at the scene, their initial assessment is crucial. They must quickly determine the severity of the intoxication and identify any immediate threats to the patient's life. This rapid evaluation sets the stage for all subsequent actions. Communication among the emergency team is vital. Clear and concise information exchange ensures that everyone is on the same page and that the patient receives the best possible care. Coordination and teamwork can significantly impact the outcome. Monitoring the patient's vital signs is a continuous process. First responders must keep a close watch on the patient's heart rate, blood pressure, and oxygen levels. Any changes in these parameters can indicate a worsening condition and necessitate immediate intervention. In some cases, advanced medical procedures may be required. This can include administering medications to counteract the effects of the intoxicant or using a defibrillator if the patient goes into cardiac arrest. First responders are trained to handle these high-pressure situations with skill and composure. Transporting the patient to a medical facility is often the next step. Ensuring the patient's stability during transport is critical. First responders must continue to monitor and manage the patient's condition while en route to the hospital. Upon arrival at the hospital, a thorough handover to the medical team is essential. First responders must provide a detailed account of the patient's condition, the interventions performed, and any changes observed during transport. This information is crucial for the hospital staff to continue providing effective care. After the incident, a debriefing session can help first responders review the case and identify areas for improvement. Continuous learning and adaptation are key to enhancing the quality of care provided in future incidents. Ongoing training and practice are vital for first responders. Regular drills and scenario-based training help them stay prepared for the diverse challenges they may face. This commitment to excellence ensures that they can provide the highest level of care in any situation. The dedication and hard work of first responders often go unrecognized. However, their contributions are invaluable. They are the unsung heroes who stand ready to save lives and protect the community, often at great personal risk. In conclusion, first responders are a lifeline for the intoxicated. Their swift actions, expert knowledge, and unwavering commitment make a profound difference in the lives of those they help. By following established protocols and continuously honing their skills, they ensure that they are always ready to provide the best possible care. As they prepare for the next call, first responders carry with them the lessons learned from each experience. Their readiness and resilience are a testament to their dedication to saving lives and serving the community. The journey of a first responder is one of constant learning and growth. By staying informed about the latest medical advancements and refining their techniques, they continue to be a vital lifeline for those in need. Thank you for joining us in exploring the critical role of first responders in managing intoxicated patients. Their work is a testament to the power of quick thinking, expert training, and compassionate care. Together, we can support these heroes as they continue to save lives and make a difference in our communities. ABCs, your first line of defense. When encountering an intoxicated patient, the first priority is always the ABCs: airway, breathing, and circulation. These three critical components are the foundation of emergency medical care and can make the difference between life and death in a crisis situation. These are the fundamental elements of life support. Without a clear airway, the patient cannot breathe. Without breathing, oxygen cannot reach the blood. Without circulation, oxygenated blood cannot reach the organs and tissues that need it to function. Begin by ensuring the airway is clear. This is the first and most crucial step. An obstructed airway can be caused by the tongue, foreign objects, or bodily fluids. If the patient is unconscious, gently tilt their head back and lift their chin to open the airway. This maneuver helps to move the tongue away from the back of the throat, allowing air to pass through more easily. Next, check for breathing. Look for chest movements, listen for breath sounds, and feel for air movement. These three checks can help you determine if the patient is breathing adequately. If breathing is absent or inadequate, begin rescue breathing immediately. Rescue breathing involves providing breaths to the patient to ensure they receive the oxygen they need. This can be done using mouth-to-mouth resuscitation or a bag valve mask. Remember, maintaining adequate oxygen supply is crucial. Oxygen is essential for the survival of all body tissues, and without it, cells begin to die within minutes. Finally, assess circulation by checking the patient's pulse. Pulse can be felt at various points on the body, such as the wrist, neck, or groin. A strong and regular pulse indicates good circulation. This means that the heart is effectively pumping blood throughout the body, delivering oxygen and nutrients to vital organs and tissues. If the pulse is weak or absent, begin CPR. Cardiopulmonary resuscitation, CPR, is a life-saving technique that combines chest compressions and rescue breaths to manually support and maintain circulation and breathing in a person who is in cardiac arrest. The ABCs provide a quick and systematic approach to assess and stabilize a patient's vital functions. By following these steps, you can ensure that you are addressing the most critical needs first, giving the patient the best chance of survival until professional medical help arrives. Always remember, in any emergency situation, staying calm and methodical can make all the difference. Unraveling the mystery, the 7 Ws of intoxication. Intoxication cases can be complex and multifaceted, requiring a systematic approach to ensure accurate diagnosis and effective treatment. The 7 Ws provide a structured framework to gather essential information and make informed decisions. Understanding the cause of intoxication is crucial for effective treatment. Without a clear understanding of the underlying cause, medical professionals may struggle to provide the appropriate care. This is why the 7 Ws are so important. They help to piece together the puzzle of intoxication. This is where the 7 Ws come in: who, what, when, where, why, with whom, and what else. Each of these questions serves a specific purpose in the diagnostic process, helping to build a comprehensive picture of the patient's condition. Start by identifying the patient if possible. Knowing who the patient is can provide immediate access to their medical history, which may contain vital information about allergies, pre-existing conditions, and previous incidents of intoxication. If they are conscious, try to determine what substance they ingested. This can be challenging, substances. Patients may be reluctant to disclose this information or may not remember. However, identifying the substance is crucial for determining the appropriate treatment. Next, establish the time frame of ingestion. Knowing when the substance was consumed can help medical professionals predict the progression of symptoms and determine the urgency of treatment. When did they consume the substance? The exact time of ingestion can provide clues about the potential severity of the intoxication and the likely progression of symptoms. Knowing the duration of exposure can help predict the progression of symptoms. For example, some substances may have delayed effects, while others may cause immediate symptoms. Understanding the timeline can guide treatment decisions. Find out where the ingestion occurred, as this might provide clues about the environment and potential dangers. The location can offer insights into the circumstances surrounding the intoxication, such as whether it occurred in a controlled environment or a potentially hazardous one. Understanding the why behind the intoxication, though not always possible, can offer valuable insights into the patient's state of mind. This can help in assessing the risk of future incidents and in providing appropriate psychological support. Were they trying to self-harm? Was it accidental? Determining the intent behind the intoxication can influence the treatment approach and the need for mental health interventions. Finally, inquire about any other substances they might have taken, as polydrug use is common and can complicate treatment. Patients may have ingested multiple substances, either intentionally or unintentionally, which can interact in unpredictable ways and require a more complex treatment plan. By systematically addressing each of the 7 Ws, medical professionals can gather the information needed to provide effective and timely treatment. This structured approach ensures that no critical details are overlooked and that the patient receives the best possible care. The 7 Ws of intoxication serve as a valuable tool in the medical field, guiding healthcare providers through the complexities of intoxication cases. By following this framework, they can navigate the challenges and uncertainties, ultimately improving patient outcomes. In conclusion, the 7 Ws of intoxication are more than just a checklist. They are a comprehensive approach to understanding and treating intoxication. By asking the right questions and gathering the right information, medical professionals can make informed decisions and provide the best possible care for their patients.